have vertigo from BPPV or is it from something else? In today's video, we will discuss and find out. For those of you who don't know me, my name is Amy McMillan. I am a vestibular physical therapist with over 15 years of experience treating vestibular disorders and concussion. I have a mission of providing people with the most current evidence-based information so that I can empower you to treat yourself and know that you are getting advice from a certified vestibular therapist no matter where you live. In today's video, we will discuss what BPPV is as a cause of vertigo. We will also discuss what it feels like based on the different canals that BPPV can affect. We will discuss the 5 indicators I look for when diagnosing BPPV. And lastly, we will talk about how to self-test for BPPV. First, I suggest printing out my new ebook so you can follow along on a guide for self-testing for BPPV. We'll put that in the description below. So first, what is BPPV? Benign Paroxysmal Positional Vertigo is exactly what that means. It is benign, so it is harmless in a sense, although can be quite intense. It's paroxysmal, meaning it comes and goes based on position, and lastly, vertigo. So vertigo is just a symptom. It is not a diagnosis. So when someone tells me they have vertigo, it just means that you either have the illusion of the room spinning around you, you see the room spinning around you, or you have the illusion of the room spinning around you, basically. So BPPV, we have our vestibular system, one behind each ear. It's small, about the size of a dime. It has 3 canals, an anterior, a posterior, and a horizontal. So we have 3 on the left, 3 on the right. Those stones, crystals, ear rocks, whatever you may have heard, they're called otoconia, calcium carbonate. If anyone is interested, they, under a microscope, literally look like little crystals, which is hence the name. So those stones should sit on a sticky little pad inside the ear. That little sticky pad is not sticky for some people. So then when you go to bed at night, those stones can fall out. Basically, it's kind of like sediment that sits at the bottom of a canal, and not until you get up in the morning or turn in bed do those stones shift and cause a false sense of movement. So this BPPV, basically, in summary, is the otoconia are in a place in the vestibular system that they shouldn't be, and they need to put back in their home. So what does BPPV feel like? To feel like a moderate to severe room spinning kind of sensation that lasts anywhere from 10 seconds to no longer than 60 seconds typically. So if anyone ever came to me and said, I was spinning for 2 hours, I would say, I don't think that's BPPV. I don't think that diagnosis is appropriate. So BPPV feels like a short-lived spinning sensation for most people when you do change positions. Now, interestingly enough, it does feel different based on the canal that it can be in. Horizontal canal, for example. My patients typically describe horizontal canal as I turn my head left or right, or I roll in bed, and that is pretty violent, and it almost feels like a lateral kind of pattern, back and forth, or maybe even like a merry-go-round this way. It's nauseating in the horizontal canal, and what you'll notice is if you do have dizziness rolling in bed, it typically will be to both sides. So a lot of people in error think that they have BPPV in both ears. That's incorrect. It just happens to give you symptoms when you roll in bed on the left and the right side. Take note, if you are testing or going to provider, which side feels more intense. That is information that we would use later. Posterior canal, which is the most common, by the way. If it's posterior canal, you'll feel that traditional room spinning sensation, like a clockwise or counterclockwise. And another pro tip, depending on which ear is involved, when somebody lays down in bed, the first thing I ask them is, if you can tell me, was it clockwise spinning or counterclockwise spinning? And that's my first indicator to guess which ear is actually involved. It can happen, but it would be very rare for posterior or anterior canal BPPV to be bilateral at the same time. Anterior canal BPPV, that tends to feel, again, kind of like that room spinning sensation, but you may feel it more when you sit up or bend over. I've had some patients experience anterior canal BPPV, and it feels more like a circular forward or backwards kind of sensation. So depending on the canal, patients can have a little bit different symptoms. I want to go back to horizontal canal because I believe that this also is an interesting symptom. After your initial head turn or roll in bed, you might feel like you're rocking on a boat all day and just a little queasy in your stomach. That's a very common descriptor with horizontal canal, is I rolled onto my side and now I just feel like I'm rocking on a boat all day. And it increases when I turn my head to the affected ear. So that's an interesting description about horizontal. Some outlier information here. If you have positional dizziness, you lay down, you feel dizzy, but you're not quite sure if it's BPPV. I have some clients who, if they don't have a strong inner ear nerve, it's less intense. It doesn't feel like that strong vertigo. So that's okay. You can still have BPPV without it being as intense if you have a weak ear nerve. Sometimes it makes it a little harder to pick up on testing, but still it's possible that you have it. It's just not very intense. Another interesting kind of outlier or difficult presentation is if someone has bilateral hypofunction. So if you know that term, you've probably been diagnosed with it. So that means your inner ear nerves aren't functioning for whatever reason. That's a whole other topic. But if you've been diagnosed with that, you probably have damage to the inner ear. The nerve isn't functioning well. So if you have BPPV and you go in a testing position, it might not be strong enough to produce a nystagmus, but you might feel a little queasy or a little dizzy, and you have BPPV, it's just not strong. So that could be for one-sided or both sides, that you could just have a harder to pick up BPPV. So next we're going to discuss the 5 indicators I look for in a subjective history if I'm suspecting BPPV. So first, we touched on it before, is time. How long does the dizziness, vertigo sensation last? If it's in the neighborhood of 10 to 60 seconds and then it stops, if you're very still, it stops, that's one indicator. Next thing I look for, I ask a patient, do you have a spinning sensation when you lay into bed? And then if you lay still, it goes away. That's number 2. Number 3, do you get dizzy when you roll in bed? And which side is worse? So if you get that spinning sensation when you roll on your right and you roll on your left, I suspect BPPV. Getting up in the morning, if you have a room spinning sensation, not a lightheaded sensation, but a room spinning and maybe a sensation of kicking back a little bit, I suspect BPPV. And lastly, it would be bending over and looking up. So if you are taking dishes out of the dishwasher, you bend over, you look up, put the dishes in the dishwasher, and you get a little spinning sensation, I suspect BPPV. So those are duration and some of the most common activities that I would suspect BPPV would actually cause symptoms. So how do we confirm our suspicion? Again, as a reminder, in the description below, I have a link to our guide to self-test for BPPV ebook. Please go ahead and download that and follow along. So the tests that I use in this order to diagnose BPPV are the roll test, the Dix-Hallpike test, and if that hasn't confirmed my suspicion, the side-lying test. So the test that you'll see in the ebook in this order is how I perform my test, are the roll test, the Dix-Hallpike, and if the Dix-Hallpike has not confirmed BPPV, I will do the side-lying test. So what does a positive test look like? What you'll notice in a roll test, for example, is you will lay on the pillow, roll onto your side, and you will feel a quick onset of dizziness, more kind of a lateral type feeling, seesawing back and forth. It should subside. You'll go onto your back, you'll roll to the other side. It will also feel like an intense dizziness back and forth. Again, it should subside. These tests can be very provocative and nauseating, so you should be seeking advice from your medical provider, and it can be very scary to do alone, so call your local vestibular therapist for help in testing for BPPV. Next test that I do is the Dix-Hallpike, and you'll see that in the ebook where you are laying back with your head over the edge of the bed. What this is going to feel like, again, is a 10 to 60 second kind of rotational spinning. So you're going to have 10 to 60 seconds of rotational spinning and a little nausea until that otoconia comes to rest. As you sit up from that testing procedure, you will also feel some dizziness. So just be slow, keep your hands by your side, ready to kind of brace yourself if you need. Now, if you test the other side, hopefully you will have a negative result, meaning your head will go back and you won't feel anything at all. So if you do feel vertigo in any of those testing positions and it does stop and come to rest, you can probably deduce that you do have BPPV and you should call your local provider for treatment. If you do all the testing in those positions and you don't feel a thing, not even the faint whisper of movement or dizziness or see any movement, that would be considered a negative test, and we can then assume that you do not have BPPV. So hopefully that helps you kind of figure out the difference between BPPV dizziness and something else causing your symptoms. So if you haven't yet, make sure you like, share, and subscribe, and hit the notification bell so you can be notified of next week's new content.